Breast implants surgery can be performed under both local anesthetic with or without sedation and under general anesthetic. In a local anesthetic, injection is given into the breast tissue, which numbs the breast completely. We can combine that with sedation. A relaxant or sedative drug is given by an anesthetist, which will kind of put you in a dreamy fairyland, and you don't remember effects of any injections. And in a full anesthetic, you're obviously totally put to sleep. Local anesthetic is very much like having epidural when you're giving childbirth. So an anesthetic is put in, and you may feel the pressure of the hand, or you may feel the bit of movement, but essentially there is no pain. When an operation is performed under local anesthetic, it can be combined with sedation, and both of these methods of putting to anesthesia have their pros and cons. In a general anesthetic, people are put to complete sleep, so they become totally unaware, and they wake up and they have the operation is finished. However, people who do go under general anesthetic obviously describe that when they come out, they can be, due to effects of various medications that have been given, they can be very sickly, they can be vomiting, they may be nauseous, they may be very groggy for a while before they recover. Obviously, they can't eat and drink straight away, and recovery takes longer, and if they are not feeling well, then they may have to stay in the hospital for 1 or 2 nights, and sometimes, rarely, the effects of anesthetic gases can last longer in terms of wearing off. The breasts themselves take a lot longer to recover in terms of healing and settling down. They can take up to 2 months to recover. The advantage of local anesthetic is that these effects will not be there. So while once the operation is finished, you wake up, you sit up, you see straight away what you look like, you walk into recovery and you start eating and drinking normally. Psychologically, you feel that I have patients describe me that they feel as if nothing has been done, and we have had patients, and then you essentially walk out, you go to your own bedroom to sleep, you recover better. It's a day case surgery, so recovery is a lot better. The other risks of general anesthesia, such as clotting in your veins and chest infection and potential risk to the tongue and teeth, which is when the tube is put down your throat, those risks are not there as well with local anesthetic. So in a way, people who have local anesthetic describe it to be a much better experience than having a general anesthetic.